Hello and welcome. My name is Laurent. I am the President and CEO of the Association of Schools and Programs of Public Health, ASPPH. And I'm speaking today in my capacity as President of the Global Network for Academic Public Health. The Global Network, which comprises 7 regional associations around the world. We have a vision of enhanced academic public health worldwide, accomplished through mutual learning and collaborations to improve and protect the health of the people and the planet. We are honored to be collaborating with the Global Consortium on Climate and Health Education, the Global Consortium on Climate and Health Education, to explore with you today the vital role that public health professionals and institutions that train them play in shaping a healthier, more climate-resilient future. Climate change may well be the greatest public health challenge of the 21st century. We have already seen evidence of its harmful effects, from intensifying weather events to changing disease patterns to loss of biodiversity and health, protective ecosystems to threaten food and water security, which impact the health and well-being of communities worldwide in complex and often highly inequitable ways. Educating and training the healthcare and public health workforce in ways that adequately prepare them for the unique and escalating challenges of climate change is really critical. We are not there yet. Studies have demonstrated that only around half of all CIF-accredited graduate programs offer one course in climate change, and far fewer provide a structured track, whether that be a degree, a program, or certificate at the MPH level. The 2020-2021 survey conducted by the Global Consortium on Climate and Health Education revealed that a gap between the desire of schools and programs of public health to address this topic and their capacity to do so. Fortunately, change appears to be taking place. Growing numbers of academic institutions are actively seeking ways to integrate and build out climate and health content in their curricula, with increasing demand from employers and the institutions themselves for robust climate and health training of public health and healthcare professionals. We must move towards collective action, helping to expand the capacity of education and training programs to produce a more proficient workforce and protect the health of populations globally against the current and the future impacts of climate change. I'm really honored to be moderating today's webinar with an incredible lineup of speakers. They are Elena Villalobos, Technical Officer, Climate and Health Team from WHO, Marina Romanello, Executive Director, the Lancet Countdown on Health and Climate Change, Cecilia Sorensen, Director, Global Consortium on Climate and Health Education, Laurent Chambaud, Senior Climate and Health Lead, Association of Schools of Public Health in the European region, Jonathan Samet, Professor, University of Colorado School of Public Health and co-chair of ASPPH Task Force on Climate Change and Health, and Margaret Kasege, President, Association of Schools of Public Health in Africa. And we'll conclude with closing remarks from John Middleton, President-elect of the Global Network for Academic Public Health. During the webinar, please enter your questions into the Q&A box, and we will get to as many as possible during our period after the session. So I now would like to pass the mic to Elena. Thank you.
Thanks so much, Laura. And thanks first to invite WHO to be part of this important meeting. I will try to share my screen. Basically, I am leading the work related to capacity building and country support in WHO. Very briefly, WHO has been working on health for over 25 years now. And what you see in the screen are the 3 areas of work that we focus our work on. So basically, the first one is supporting countries to understand and address the health risks posed by climate change, that, as you know, are quite wide in range. The second one is working at health systems and healthcare facility levels, both building climate resilience and decreasing their emissions and their environmental footprint. And the third one, and probably most important for the future generations, is basically promoting those mitigation options that are accompanied by most health gains. WHO has been supporting countries for many years now. I joined the organization in 2009, and since then we have been able to support over 50 countries and raise over 150 million for implementation of climate change and health interventions. So basically, just working with countries help us to learn from them and to basically develop a comprehensive and systematic approach to support countries implementing climate change and health interventions. This is the operational framework for building climate resilient and low carbon sustainable health systems. The first version of this operational framework was developed in 2015, and then it has been updated last year just to integrate within this overall framework the low carbon sustainability space, because at the beginning we were mainly focusing on building climate resilient. I am sure this because this is the structure that we use both to develop our capacity building support, but also how we structure the proposed interventions at country level. So basically, today we are discussing about the importance of capacity building and the role of the health workforce to advance climate change and health at national level. So for us, it's essential that this health workforce in WHO basically has the competencies and the skills that will be required to implement the 10 components that you see summarized in this operational framework. So the first one is about climate transformative leadership and governance. So it's a lot about understanding how to develop, for example, a health component of a national adaptation plan, or to develop a healthy NDCs, nationally determined contribution. Everything related to health systems, health information systems, for example, we will also need public health professionals that know how to conduct a climate change and health vulnerability and adaptation assessment, or that at the minimum, they know the process and how to engage those experts that will help them to first understand current vulnerability to climate change, but also future risks to climate variability and change. We will also need professionals that basically know how to integrate climate and weather information into the surveillance systems that they are using already to monitor climate-sensitive diseases. We will also need professionals that know how to assess the greenhouse gas emissions of the health systems or facility level. And of course, we will need lead champions to motivate others to do, for example, more in their own personal sphere, like reducing waste or reducing transport and commuting. Something that is very important also is what you see on service delivery. So basically everything in blue, we are working with countries to integrate and to develop disaster risk reduction plans, to work with other sectors, for example, with the water and sanitation, with nutrition, with food systems, basically to ensure that the health outcomes of interventions in other sectors are maximized. So, for example, we have approaches that promote climate resilient water safety plans, sanitation safety plans, sustainable diets, food safety, and of course, finance. And I think that's basically it. We have lots of guidance for each of these components. So basically, WHO, to provide country support, we mainly work with the Ministry of Health and professionals that are already there, and also experts, for example, from universities already existing in the country, and then accompany them to implement the specific processes that we are going to promote in the country. Could be around climate resilient and environmentally sustainable healthcare facilities, could be to develop a health component of a national adaptation plan, could be to develop a healthy NDC to conduct a climate change and health vulnerability and adaptation assessment. So basically we train them and then we accompany in the process of then implementing those tools. This is the approach that we have for healthcare facilities. I will not go into detail. Something that is important, I think, coming back also from COP28, is that as WHO, we have seen an exponential increase on the momentum and the priority that countries are giving to climate change and health. Back in COP26, which was 2021, under the presidency of the UK, basically there were two key initiatives launched, which were related to climate resilient health systems and low carbon sustainable health systems. And for those, we now have over 80 countries that have committed to their, at Minister of Health level, to their own populations to build climate resilient and low carbon sustainable health systems. Building on that, we created the ATTACH, the Alliance for Transformative Action on Climate and Health, in 2022, June 2022. And basically, this ATTACH has been positioned as the key platform aiming to support countries for implementation. So basically, it's not an advocacy platform, it's really a platform looking to move to implementation and to support countries to move to action. It has 5 working groups, one on climate resilience. You can see the co-chairs there, Ivory Coast and Health Canada, decarbonization of health systems, LAO PDR and healthcare without harm, supply chain, Bangladesh and England NHS, finance, Germany and the World Bank, and nutrition and climate change, Egypt and GAIN. Then in COP27, there was also a very important initiative launched by Egypt, which is the one that has been adopted as the fifth working group in the ATTACH, which is nutrition and climate change. And then I think COP28 basically was a game changer because it was the first health day organized there, but they were very big steps engaging on climate and health. I just was discussing just now before with the COP28 presidency team and the UAE Ministry of Health. As of now, they have already 149 countries that have signed the declaration on climate change and health. There was the presence, physical presence of approximately 50 ministers of health and over 75 ministries overall represented. The WHO call to action was endorsed by organizations representing over 40 million health workers, and there were pledges for finance on climate change and health of $1 billion US. With regards to health professionals, it was the first time that we have such a great representation at the COP. And as you can see there, almost 2,000 participants out of the approximately 80,000 that joined the COP28 represented the health sector. And you can see the distribution where they were coming from. But basically, this is an exponential increase of health representation at a COP. And it clearly shows that climate change is being felt as a priority by the health community now. There were mixed results in the negotiations. So, for example, under loss and damage, it was operationalized. So this was a great achievement. And then there were also some pledges for funding almost 700 million. There was the global goal on adaptation was approved, and I will give more details afterwards. And the global stocktake basically included reference to transition again away from fossil fuels to net zero by 2050. The strength of the wording has been questioned, but it's the first time that this language is included in any negotiated outcome of a conference of the parties. With regards to the global goal on adaptation, it is very important because under the overarching adaptation target, health is implicit, as you can see there in the well-being part. But then there is a specific target for health, which is related to attaining resilience against climate change-related health impacts, promoting climate-resilient health services, and significantly reducing morbidity and mortality, specifically in the most vulnerable countries. Building on all this, I think the overall health community needed some time to realize all that happened at COP. I think many of us who have been following the negotiations and the process for many years were kind of shocked to see all this really being materialized, listening and watching all these ministers of health, looking at the declaration. And we were kind of moved that we are at this moment. What this means basically is that the health community has a very important role to play now, and capacity will be required to be able to materialize this priority, to be able that we are ready for what is coming, to be able to lead by example and to continue convening the message that the health argument is the real game changer when it goes to both mitigating and acting to climate change. For WHO specifically, as you know, we are the secretariat for this Alliance for Transformative Action on Climate and Health. We are the first physical meeting in Madrid in 2 weeks. And basically, we want to build on everything that happened and really come up with priorities for the attached to support countries, attached as a collective platform, not only WHO, to really understand the needs by countries to go to implementation and then basically be able to deliver. So basically, I think that's my overall reflection. As WHO, we are seeing a lot of demand, we are seeing a lot of interest, and what you are doing here today and the priority that you are giving to capacity building, to the role of the Association of School of Public Health, to the National Schools of Public Health, and the role of health professionals is very important. It is huge, the task that you have in front of you, and we are counting on you really to help us build the capacity of all these health professionals that will be at the forefront of everything that is going to happen now. So thank you again.
Thank you so much, Elena, for your remarks, your presentation. And we want to acknowledge everyone that has been joining our webinar. Thank you for being here. You can see that we have representation from around the world. We encourage all of you to ask questions in the Q&A box, and we'll be answering them through the presentations or at the end, hopefully, if we have time. So with that, let's hear from Marina Romanello from the Lancet Countdown on Health and Climate Change. Marina.
Hi, everyone. Thank you so much, and thank you for joining. I'm going to try to share my slides. Please let me know once you've seen them full screen. Is that showing?
Perfect. Thank you.
Excellent. Thank you. Brilliant. So I'm going to tell you today a bit about the work of the Lancet Countdown, our work in exploring the health impacts of climate change and why it's so important that we build capacities for climate resilience, particularly from the health sector. And I think it's very well aligned with what you've just heard from Elena, but I'm going to focus a bit more broadly beyond the health systems, just the role of health professionals when it comes to climate change and health and securing a livable future. But before we go there, just to acknowledge that the work I'm going to present to you is the product of 114 people with collaborating institutions all around the world and in key partnership and collaboration with the World Health Organization. So you'll see some of their data as well. And it's published in our latest report that we published last November. So you can see that online. It's available free for download at the Lancet. You just need to register in order to access it. Well, I said I would focus on the health impacts of climate change. I only have one slide on the direct health impacts of climate change because the health impacts of climate change are being felt throughout many different aspects of our foundations of health. And what I wanted to show you is what some of these indicators look like without going too much into detail, because it would be impossible to cover thoroughly the multiplicity of the health impacts of climate change on health in just a few minutes. But as you can see on screen, climate change is already affecting different aspects of our health and well-being. Heat-related mortality is increasing globally as a result of the obviously rising temperature. We estimate that heat-related mortality in adults over 65 years of age has increased by about 85% since the 90s. And this is more than twice the level of increase that we would have expected under constant temperatures. What that tells us is that the vast majority of the increase in heat-related mortality is due to the rising temperatures, and that has to do with anthropogenic climate change. We're monitoring mortality, but obviously underneath this mortality, there comes a huge burden of disease, increased morbidity, hospitalizations, and impacts not only on the physical, but also on the mental health, and also indirect impacts on human health and well-being. We know that exposure to extreme heat limits labor productivity. It limits our drive to exercise, for example, our capacity to exercise safely outdoors. It can obviously put people that are undertaking physical activity, which is fundamental for good health, physical and mental health. It puts them at increased risk during extreme heat days. So it limits our capacity to safely exercise outdoors. And it also limits our capacity to do physical labor in particular. And what I'm showing you here in this second graph, the bar chart, is the average loss of earnings due to the loss of labor that comes associated with heat exposure. Rising temperatures increasingly limit people's capacity to work, limit labor productivity, and that obviously results in a loss of income and of labor capacity. And what you can see here is countries of the world divided according to their Human Development Index group. And what you can see very clearly is that as a proportion of GDP in relative terms, the countries that are worst affected by loss of income due to exposure to heat are countries in the low Human Development Index group, with this clear ladder that shows us that the most affected countries are generally those with lower incomes, with higher vulnerability, affecting the economic, social conditions of good health and well-being, and particularly affecting agricultural workers that are particularly vulnerable and who have limited capacity to shield from the heat, and on whom generally in these countries food productivity depends. Associated with this, we're seeing an increase in events of drought, particularly in the Horn of Africa, an area heavily affected by droughts, but also in other areas like the Amazonian region, increasing there the risk of forest loss. And all in all, drought is increasingly affecting our food security, our water security, and our agricultural productivity. And looking directly at food security, we're seeing food insecurity rising globally as a result of the increased incidence of heat wave events and droughts events. We estimate about 127 million more people experienced food insecurity in 2021 than in 1981 to 2010. And this was directly linked to an increased incidence of heat waves and drought events. And we're, of course, seeing that because of the changing climatological conditions, infectious diseases are beginning to spread in new locations. The environmental conditions are becoming suitable for local transmission, particularly of vector-borne diseases that are transmitted by mosquitoes, by ticks, by other arthropods. Also water-borne diseases, food-borne diseases, and airborne diseases. So any disease that is transmitted through the environment to humans directly. And as you can see, a big increase in the environmental suitability for the transmission of dengue. We estimate it has grown about 30% since the 1950s. And in the case of malaria as well, we're seeing environmental suitability growing, particularly in highland areas where we didn't used to find the Anopheles mosquito, and particularly in northern latitudes in Europe, a big sharp increase in the environmental suitability for transmission. So I'm giving you just a few examples, but the important thing to note here is that these climate risks don't happen in isolation, as you will have probably inferred from what I just said. They happen all at the same time. They compound each other in many cases, and they're leading to a situation that is affecting our economic determinants of health, environmental determinants of health, is leading to an increased incidence of physical and mental ill health. And it's also affecting the socioeconomic factors on which our good health depends. So these compounding impacts are generating a bit of a perfect storm, putting extra pressure on our health systems and undermining public health efforts, including infectious disease control efforts. So this goes back to what Elena was just talking about. It is so crucially important that our health systems are prepared to cope with this perfect storm of increased health risks, because the pressure and the burden of disease ultimately falls on our health systems, and our health systems are the first line of defense against climate change. So with that, I wanted to show you some data that actually Elena and the team at WHO share with us that comes from their country survey. And this is just one example of many. But in this particular example, I'm showing you the number of countries that have climate-informed health early warning systems against specific climate-sensitive risks and diseases that are growing globally. And as you can see, according each and every one of those risks, those health risks that we're monitoring, including airborne illness, heat illness, mental and psychosocial health, non-communicable disease, we're seeing always that when we look at the countries according to their Human Development Index, it is the low Human Development Index countries that are most lagging in the adoption of these health protective measures, these essential interventions. And what this shows us is that while the health risks of climate change are growing, they're disproportionately affecting the most vulnerable communities, those that contributed the least to climate change. And those same countries are also lagging in the capacity to adopt health protective measures. Much of that lag has to do with a scarcity of funding, also a scarcity of technical resource and knowledge transfer. That's why it's so important to build capacity globally, and particularly in the most vulnerable countries, to cope with the increased pressures of climate change. And we're still lagging enormously behind. The ASPHER program of WHO in part is trying to tackle this, which is crucial. But what we're doing in terms of climate change and adapting to climate change is hugely informed by our science, by the evidence that we hold. And you can see here, for example, in terms of mental and psychosocial health, mental health is enormously impacted by climate change, both directly and indirectly, but we have relatively little evidence on the mental health implications of climate change. And it's also an area in which our protective services are lagging. And we have an enormous bias in terms of how the evidence is generating, where it's being produced, and the information that it provides us. So when we look at scientific publications and where science is being made, which areas we're studying, we see this enormous skewing towards very high Human Development Index countries. This graph that I'm showing you here on the left are quantifying the number of scientific studies that look at the health impacts of climate-sensitive events that can be attributable to anthropogenic climate change. So looking specifically at impacts of climate change that can be attributed to human-made climate change. And we see this huge skewing towards very high Human Development Index countries. We have about 5 times more studies per million in very high Human Development Index countries than in low Human Development Index countries, which again means those countries that are most vulnerable, the most affected, are the ones that we know the least about, and the risks that they're facing, the ones that we know the least about. And in terms of the types of studies that we're publishing, you can see here on the right, also mostly focusing on the health impacts of climate change, but we're not yet beginning to tackle what probably matters the most, that is what we need to be doing in terms of adaptation and mitigation to climate change to promote better health, better well-being. So also a lot to be done from the health community in terms of understanding our possibilities to act on climate change and health for health in particular. I've shown you some of what we're seeing today, and this is where we're at, but perhaps the thing that brings things more in perspective is that everything I've been telling you about until now is happening already at 1.14 degrees of global mean decadal heating. We're currently on track to 2.7 degrees of heating by the end of the century, around 3 degrees of heating by the end of the century. The upper threshold of the Paris Agreement, what we've all committed to delivering, calls for a limit of temperature rise to 2 degrees, preferably to 1.5 degrees. And when we look at what that might hold for us, even if we manage to limit global mean temperatures to 2 degrees, we would see an enormous increase in every single one of the health impacts that we're facing. 370% increase in heat-related death of adults over 55 years of age, 50% increase in labor capacity loss, or almost 500 million additional people suffering food insecurity, infectious disease transmission growing, etc. So given this, and given that we're currently on track to 3 degrees of heating, it's so important that we minimize our greenhouse gas emissions, that we tackle climate change to keep temperatures as close as possible to 1.5. And here, the most important thing, I think, within this conversation is that many of the interventions that we need to be delivering in order to reduce temperatures, to tackle climate change, go hand in hand with very sensible public health interventions. So from the point of view of public health systems and of health professionals, there's a lot that we can do to tackle climate change, to reduce emissions, and at the same time to deliver healthier populations, which are also more resilient to the impacts of climate change, reducing the pressures on our health systems and being able to cope and adapt to the impacts of climate change. So looking at one of those areas of work, the obvious one is air pollution. We estimate that about 2 million deaths occur each year due to the burning of dirty fuels from outdoor poor air quality. These 2 million deaths are from the burning of fossil fuels and biomass, and only considering outdoor air pollution. But if we consider also that we today have millions of people around the world that don't have access to clean energies in their home, the WHO estimates that about 1 billion people globally don't have access to health systems with stable energy access. We have about 1 billion people globally that don't have access to electricity in their homes. And people are still burning dirty fuels, biomass inside their homes. And that is leading to very poor indoor quality, people breathing toxic airs in their homes. And we estimate in 62 countries that we've reviewed, mostly low and middle income countries, that this is yielding a mortality rate of about 100 deaths per 100,000. That's an enormously high burden of disease. So there's a lot that we could do through public health interventions to promote improved air quality that would also help tackle the emissions that come from fossil fuel burning and from land use change for the use of biomass. Again, hand in hand, public health and climate interventions. And then looking at our diets, also unhealthy diets are generally very rich in highly processed foods, in red meat, in saturated fats. And we're seeing that agricultural emissions, about 57% of all our agricultural emissions come from red meat and dairy production, highly carbon intensive activities. And they also lead to about 12.2 million deaths every year. So by promoting healthier diets, we can also help reduce our pressure on the environment, build healthier populations and more resilient populations. And finally, obviously, the role of the health sector. The health sector contributes to about 5% of all global greenhouse gas emissions. We have estimates per country. And importantly, the consumption of energy from the health sector is also contributing to air pollution. We estimate about 4 million disability-adjusted life years annually happening from exposure to PM2.5 air pollution that comes from health sector activities. And importantly, the health sector has a control of about 10% of all global GDP. It makes up 10% of global GDP. So it has an enormous influence on our global economy. So again, if delivering care, we mustn't do harm. And it's the duty of the health sector to ensure that its activities do not harm health by environmental degradation. And this is a clear example of the power of decarbonizing the health sector and the cascading effects that can have on the overall economy. So just to close, a couple of reflections on the critical role of the health sector and why it's so important to build capacity to tackle climate change, to tackle adaptation to climate change, and to reduce emissions. The health sector represents the first line of defense against the impacts of climate change. It's central to climate change adaptation, and we need to better understand and build capacities to be able to lead with the growing health risks of climate change. It can also help increase the knowledge and awareness of the health dimensions of climate change and the health opportunities of climate action, helping steer our global efforts to tackle climate change towards a healthier future. Many public health policies can contribute to decarbonization, and it's up to the health sector to deliver many of those policies, and we could make an enormous change towards global greenhouse gas emissions. In our direct control, that 10% of GDP 5% of all global greenhouse gas emissions is enormously substantial. So learning how to practice care without contributing to carbon emissions is enormously important. And obviously helping shape those climate change policies so we ensure that we're maximizing the health benefits of them. So with that, that was a bit of a quick overview, but I thank you very much for your attention and invite if you want to learn more about the indicators to visit lancetcountdown.org. Thank you very much.
Thank you so much, Marina, for this presentation and just to make us aware of the importance of the topic and why we need to really collaborate urgently in this matter. Thank you for that. So now we're going to hear from Cecilia Sorensen. She's our host, Director of the Global Consortium on Climate and Health Education. Cecilia.
Thank you so much, Laura, and thank you everyone for being here. It's really, really wonderful and inspiring to see people joining from all over the world. So good morning, good afternoon, good evening. My name is Cecilia Sorensen. I'm the Director of the Global Consortium on Climate and Health Education. And today I'd like to share with you a bit about our work in this space in terms of how we can upskill and build capacity among public health professionals to tackle these myriad health impacts that we've just been hearing about. So one thing I want to call attention to is a finding in the most recent IPCC report, which is that the severity of climate-related health risks is highly dependent on how well health systems can protect people. It's been said before, but we are the first line of defense. We're also the last line of defense in terms of preventing health impacts on populations. But the silver lining here is that we know that with timely, proactive, and effective adaptation, many of the risks for human health and well-being can be reduced and some potentially avoided. And that's a statement that's made with very high confidence. So how can we move towards this place of adaptation and of preparedness in the public health workforce? Well, we have to start with where we are. And according to data from the recent WHO Climate and Health Country Survey, about 50% of countries have flagged insufficient human resources as well as insufficient technical capacity as a major barrier that is preventing countries to be able to adapt and to be able to do this essential work that we know needs to happen. And so in response to this barrier that we're facing, the Global Consortium on Climate and Health Education was formed. And we are an international consortium of over 350 health professional training institutions. And these schools have pledged at the level of dean or head of school to train their students in climate and health. And you can see our network partners here from every continent. And we know that through our networks, we're reaching an estimated 200,000 students annually, which is a lot. But the reality is that it's not enough. And we have a vision to continue to grow, to build the capacity where it is needed. Now, we're talking about public health today, but I want to zoom out a little bit to say that it's not just public health that needs to address this crisis. There's many different communities that we need working interprofessionally together around the crises that we're facing. But public health has an essential role. We also need strong policy and institutional support in order to get this work done. So we showed this graphic earlier, Elena did from WHO, but if we really look at each of these areas of what it takes and what the strategy is to build climate resilient health systems, we can look at each of these buckets and think, how can we skill ourselves and future generations of public health practitioners to be able to participate meaningfully and to lead national, regional, local initiatives in each of these buckets, because we have to build capacity really everywhere. So at the Global Consortium, one of our activities is that we work with interdisciplinary, interprofessional groups in order to develop what we call our core competencies for health professionals. In order for us from any health background to be able to fill these roles that we know are so needed, we have to start with how we administer education in our institutions. And so what these competencies do is they really lay out those fundamentals of how we as faculty can be approaching climate and health education. And we'll drop a link in the chat to these competencies in a minute here, but just a brief overview. These competencies cover climate and health knowledge and analytic skills, climate change and public health practice, climate change and clinical practice, as well as policy aspects of climate change and health, and climate and health communication, because we know that as health professionals, we are some of the most trusted and powerful messengers of climate information. An example of how these competencies have been used in practice: about 18 months ago, the Global Consortium partnered with ASPPH and created a toolkit for how to integrate the core competencies on climate and health for health professionals into existing public health criteria for Masters of Public Health programs. So in North America, we use the CEF competencies, that's the Council for Education and Public Health. And so with ASPPH, we worked to basically integrate the GCCHE core competencies into what that would look like in terms of the CEF competencies. Sorry, there's some background noise. And so what this looks like is that we see that these competencies for public health professionals can be married really nicely and integrated into existing competencies. And so what you'll find in this toolkit is really a blueprint for how you at your institution can build a climate and health MPH concentration, which we know we need more of. You'll find a blueprint for how to even just build a climate and health course, right? What are those fundamentals that we can give to our students in a semester-long course? And then we have a blueprint for really how you can integrate climate and health into the core curriculum. So it's not just a specialized group of health professionals that's getting this education. It's everyone, every public health professional who passes through our programs leaves with some knowledge of what the role of climate change is in the future work that they will be doing. Now, with this work, we know that actually students are a driving force. They are asking for this type of curriculum. I think they see this as a crisis of their time and something that they want to tackle. And so we know that we have to actually upskill the current generation of health professionals, the people who are already occupying offices in the public and private spaces and in our academics. And so we have many initiatives at the Global Consortium that we make freely available to anyone who's interested to learn more about how to integrate climate change into their public health programs. Every 2 months, we host a member learning collaborative where we invite schools who are members of the consortium to present on what they're doing, to tell you about their curriculum, the challenges, the opportunities, the barriers. And so this is a space where you can come with questions and also come for ideas, for ways to get stimulated and inspired to create and to improve curriculum at your school. We also run a monthly climate and planetary health office hours, and this is hosted by our incredible medical working group at the Global Consortium. This is a space for you to come with any questions you have, or if you're just interested in sort of collaborating and meeting people who are working in the space. This is a really friendly environment, and anyone is welcome to join. We also run a lot of courses. The way we have strategized this is around levels 1, 2, and 3. We know that we have to build fundamental climate and health knowledge, continue to build deeper learning and application of climate and health, and then think about how we can really inspire and enable action and engagement. And so we offer right now a suite of courses in order to achieve these outcomes for the global health workforce. Just to give you a couple of examples, our level 1 course, the Climate and Health Responder course, has already been run in 5 different regions. We currently have it taking place in the European region with an incredible collaboration with ASPHER, who you'll hear from in a little bit. And this has been just incredible to see. We've had over 4,000 people sign up for this course. And this is going through the basics of climate and health and thinking about how we apply these to our daily practice. Our level 2 courses, again, are going more towards developing deeper appreciation, deeper application of climate and health knowledge and skills. Here's a couple of examples of courses we've run, which we will continue to run in the future, again, in different regions. And we have level 3 courses. So thinking about leadership, thinking about those deeper technical skills that we know some health practitioners will need in order to move the entire health system towards a place of resilience. I want to mention that most of our courses are offered completely free of charge. All of them are certificate-based, and many of them have continuing professional education credit associated with them. So we invite you to join us. Now, we know that you can't manage what you can't measure, and we're really excited that we have developed an indicator to track capacity building on a global level. Capacity building of the health professions is really a core component of resilience and of adaptation to climate change, but we currently don't have a full understanding of where capacity building is happening, and therefore we don't know where we need to focus our resources. So to address this gap in our knowledge, we have a survey that is going around right now where we are surveying schools of public health globally to understand what their current state of climate and health education is. So if you are sitting at a school of public health somewhere and you're a faculty member, we would love for you to take this survey. The QR code is here, and we'll also drop a link in the chat right now. Even if you don't have climate and health education, we still want to hear from you. We want to understand what's happening out there so that we can in turn build the resources in order to enable action everywhere. So I'm delighted to be here with everyone today. We're excited to have you. And with that, I will turn it back over to Laura. Thank you.
Thank you so much, Cecilia, and thank you for the incredible work the Global Consortium does to really to help all the schools, not just, as you heard, not just public health, but all the health professionals, and actually beyond the health professionals. I think that I really encourage all of you to see what the Global Consortium on Climate and Health Education has for you to offer. They have been really working tirelessly to have really the resources, the tools, the courses, the competencies. ASPPH is really proud and honored to be really a part of the Global Consortium, because it has been really incredible to find all the resources that our schools need in order to really implement and act on this. So I encourage all of you to go and see explore their site. All right, so with that, we have with us Laurent Chambaud. He's senior climate and health lead in ASPHER, which is the Association of Schools of Public Health in the European region. To you, Laurent.
Thanks a lot, Laura, and I hope that you hear me and that you see the slides. I have only a few slides, and firstly, I would like to say that I'm honored to be with you, and thanks for inviting me in this webinar. And I'm really, I will be very happy to share some ideas and some initiatives with this prestigious panel and with all the people that are attending this webinar. So my name is Laurent Chambaud, and I'm the Climate Change and Health lead in ASPHER, the Association of Schools of Public Health in the European region. Let's go to the next one. So I would like to share with you three main things about what could be the role of the schools of public health. The first one is, of course, in training. And in training, in this slide, I would like to present you two different things. The first one is who will be the public? And on the left, you see that, of course, we have as schools of public health, like the public health professionals. But I think that, and it has been said before, as public health institutions, we also have to interfere to have some relationship with health professionals, with health managers, with NGOs at different levels, and also with the public policies makers. And that means that we need, and it has been said just before by Cecilia, and I want just to comment on that, that means that we have to develop different levels. So Cecilia just presented 3 levels. I will present 4 levels for what we could do as a School of Public Health. And if I go reverse from the bottom to the top, the first one is quite obvious. We need to develop public health expertise in climate change and health. But that means that we have also to try to develop, to have a reflection on, do we have to develop some dedicated masters like some do mainly in US? Of course, we have to develop some specific PhD, or do we have, and it's the one that you see here, to adapt modules for public health academic training. That doesn't mean that we have to choose between both, but we have to, in one hand, to develop a very specific public health expertise, but we also have to be sure that all the people who will be trained in public health will have something in terms of training on climate change and health. And it's why, and it's exactly the mirror of what has been said before by Cecilia. We are trying to develop at the European level in the core curriculum in public health, in the core curriculum and competencies, a specific module on climate change and health. It's what we are doing now. And the two others, I think, are very important for people in public health. We need also to develop something for many people who want to know some specific things or to have a basic on climate change and health. And it's why it has been said also before, we have to develop more than we do now, some CPD modules for specific needs, for specific publics who need to know some specific things, or to have a continuous development on what are what the research is doing on this area of climate change and health. And the last one, it has been said also, because it's what we do now, is to try to have the basic knowledge for all stakeholders. And it's why we do with the Global Consortium on Climate Health Education. Now we are at the third session of a very, very impressive, intensive course in Europe, but all the people who attend the meeting are from all over the world. So, so the first slide was on training. I would like also to do something about research, because we have also to develop research as a School of Public Health. We have to develop research on health impact of climate change. I think that the main goal in terms of research will be to develop and disseminate knowledge on direct and indirect effects of climate change on health. That means not only to develop knowledge, but also to disseminate this knowledge. And for that, we need to have some pluridisciplinary research. We need also to invest on new areas of research. And there is something that we have, a question that we have to raise, because it's obvious that there are many links between the concept of One Health and what we do on climate change and health. So we have also to try to develop new research. I don't know if it will be just labelized like One Health or like climate change and health, but we have to develop this research in not only pluridisciplinary, but transdisciplinary research. And we have also to invest on new methods, like hybrid methods, that means quantitative and qualitative, but also to develop participatory research. And I think it's really important. And I also think that we have to develop some specific areas, for instance, developing risk assessment, but also to develop the use and the analysis of massive data to enhance the early warning and preparedness systems, and or to natural or to human-made hazards. I think it's really something in which School of Public Health are expected to deliver, is how we can optimize the early warning and preparedness systems. It's really something important for us. But also we have to develop knowledge, and it has been said by Marina before, we have a lot of research on the impact, but we have also to find solutions. Research is not only to look at the problem, but also to look at the solutions. And so that means that we have to invest more than we do now to solutions, local or not, or national or international solution, to decrease or to mitigate the negative impact of climate change on health. It has been said also before, but I want to really underline this. Public health has a role to revisit our healthcare organization. And to go perhaps further than what has been said before, I think that many healthcare systems have to be transformed. We are on a key point, and I think that all the healthcare system, even the healthcare system for the well-developed countries, now are questioned, are challenged by what happens in many ways. So that means that we need to revisit our healthcare organization. And of course, to participate to European and to international projects. On expertise, I will go very briefly because I think it's a result of all that. We have to bring together different disciplinaries, it has been said before. We have to bridge between different areas. And as public health professionals, we have to bridge with other areas, veterinary, ecology, and so on. And it's returned to the concept of One Health. We have to develop and disseminate early warning system. It's our role, and we have to do that. We have to develop and to evaluate programs to mitigate the health impact of climate change at different levels. And it's really important that we don't have to work only at one level. Local is important, national is important, regional is important, and also international or planetary is important. And last but not least, we have to participate in media and with citizens fora to disseminate and update knowledge and also to look at what are the remaining questions. We have also to develop some, what are our ideas, what we want to do. And for instance, you look at this QR code is what was the statement of ASPHER during the COP28. I think we have to develop statements. My last slide is just to say that we have to, sorry, because it's 10 minutes. So my last slide is just to say that we cannot do that alone, the School of Public Health. We have to build in partnership. Of course, with all the network of School of Public Health, and many of them are here today, and I'm very glad to have all these networks working together, but also with other public health organizations. I think the organization like IONFI with public health institutes, but also with health, and I would say like Cecilia, health and social professionals organizations at the local, national, or international levels. We have to work with other institutions dedicated to climate change and health. So you have some examples and what has been presented by Marina, like the Lancet countdown. We have to work together on that. We work very closely with the European Observatory on Climate Change and Health. We have to work with international organizations, of course, WHO, but also the organization that organize the different COP. And for instance, there is a World Urban Forum in November in Cairo on this topic. We have also to be present at that such forum. And last, we have also to build partnership with the community representative, with all the stakeholders at the different level, because if we want to be useful, we have to work with people. So it's what I wanted to share with you, and thank you for inviting me.
Thank you, Laurent, for your presentation. Thank you for reminding us the scope of our work, because it's just not about training, but it's about also research, advocacy, partnerships. It's like we have a lot to do. So thank you for your presentation. So with that, let's welcome Professor Jonathan Summit. He, as I said before, he co-chaired the ASPPH Task Force on Climate Change and Health. So,
great, thank you, and hello to everyone. And not surprisingly, I'm going to say some things that echo what Laurent said as I speak for the task force of the Association of Schools and Programs in Public Health on Climate Change and Health. The framework I'm going to tell you about represents the start of the work of ASPPH in the climate change and health space, and will be ongoing. We've gone from our first phase now to our second phase, as I'll tell you. And here we represent many organizations, both in the United States and internationally. The reason, of course, for doing this is the urgency of responding to the problem of climate change and positioning climate change and health as a critical part of what we need to address in a place that our schools and programs in public health are well positioned to take on. Our framework is shown in this circle. The domains within are what we do in academic institutions: education and training, research, practice, policy, and advocacy. And if you'll notice, the circle is ringed by overriding principles of partnership, collaboration, and justice, with these components that will be threaded throughout the activities proposed in this framework. We acknowledge the challenges, the complexities of the tasks, and we've already heard about those issues. So here's my co-chair, Lynn Goldman. We had a very active task force in our first phase and have gone on to our second that I'll just touch on at the end. Our undertaking this through ASPPH has multiple motivations. The necessity of responses from our schools and programs of public health. As mentioned, the expectations of our students who look to the future and wonder about the world as it evolves under various climate change scenarios. We see a leadership role and fundamental to what we do in public health, addressing inequities. And of course, for climate change and health, there are equities at multiple levels, ranging from local to global. The moment is now, as others have already said. So I mentioned that across our domains, we have these cross-cutting themes: health equity, environmental justice, and social justice, partnerships for impact. Our schools need to be partners with local collaborators, national and global. And we, as schools of public health, can reach to governmental and non-governmental sectors. And then again, as already mentioned, the need to have collaborations that are interprofessional and interdisciplinary. And again, our schools are well positioned to develop these sorts of collaborations. We already do for many problems. The domains, the four, as I mentioned, are the familiar ones. And so far, we've heard a great deal about education and training, which has a central role in the report of our task force. Research, again, already mentioned. Here we look to our research findings as not only levers to try and motivate policy action, but also to provide guidance on those populations who are most vulnerable and susceptible, those for whom adaptation is most critical, and those who will be harmed the most if adaptation is not successful. For practice, our schools and programs are positioned to engage with the communities in their neighborhoods and the communities that are beyond. Many of our schools have a broad reach. And then, of course, practice, and as I mentioned, in policy and advocacy. Just as one example, education and training under foundation, we list the motivations for what needs to be done, some of what is available, and then the needs to have expanded climate-based curricula, to develop the competencies, to have a workforce that can use the scientific information and translate it into policy, translate it to communities. And then turning back to the report from describing our framework, we have a set of fundamental principles that are listed. I'll point you towards the document at the end of the presentation. We have recommendations. The recommendations apply to ASPPH, the overall association, and to the schools and programs in public health. And in the report, we provide recommendations for our umbrella organization, and for the schools and how they need to work together. We set out recommendations on short time frames and long time frames, focused around these critical areas. And in the document, you'll find discussion, as shown here by the arrows, of where we need to have actions, whom we need to partner with, both internally, the orange at the top, and then our external partners, the deeper color at the bottom. So the framework provides an organized approach, a way for our schools and programs to think about what they need to do. And again, just as examples, here are immediate recommendations for the schools and programs around education, to understand what our expertise is, to begin to work on partnering, to develop curricula, our work in practice, policy and advocacy, one target, for example, looking at divestment of university endowments that support climate harmful actions. And then, of course, research, and at least in the United States, research is now sparked by funding for the U.S. National Institutes of Health. We list out strategies for implementation, what we need to do, shown here in the circle, with the elements of that circle to the left side of the slide, education alignment, and so on. A powerful agenda for us, and one that involves certainly moving beyond the walls of our academic institutions if we are going to have impact. So finally, moving on to implementing the framework. Here are some of the things that we are committed to doing, that we outline in the task force report, and that will be what we do as schools and programs of public health with ASPPH moving forward. So we have our individual institutions that will be anchored in the ASPPH and its resources. We've gone on now to our second stage, involving the development of core foundational competencies related to the MPH and DRPH degrees, and we are just getting started on that, and we'll be seeking broad input as we move forward. There are a variety of resources, and these are available at the ASPPH website. Thank you, and look forward to continued collaborations and discussions.
Thank you so much, Professor Samet. Thank you for your leadership in ASPPH in this topic. And again, I encourage all the participants, all the people who are joining us in the webinar, to go to the ASPPH website. We have all these resources. You can download them. And there's a lot of work and ideas and recommendations and call for actions in the field of academic public health. So just please join us in that effort. So, and now we're very, very proud that in these presentations, you already saw that there are three main of the regional association of public health schools and programs that are presenting. So ASPPH is presented, but we heard already from Laurent, Chambaud from ASPHER, and now we have a great presentation from Margaret Kasehe. She's the president of the Association of Schools of Public Health in Africa. So Margaret, to you.
Thank you so much. I hope you can hear me. I'm really privileged to be able to share a little bit, focusing on what the issues are for Africa. We really need to confront the undeniable crisis of climate change. And it's a crisis that is leaving deep and far-reaching impacts, especially in Africa. Let me just give you a snapshot of some of the conversations we are having. In one of our engaging dialogues with rural communities, which involved elderly members seasoned with the wisdom of age, there was a unanimous acknowledgement of the drastic shifts in rainfall patterns. They've experienced both excessive rain, prolonged droughts, and they've expressed that the environment has grown increasingly hostile. They attributed this to climate change, which they believe has amplified the vulnerability of communities and households and has escalated health issues such as malaria, which has been mentioned before, cholera, typhoid, malnutrition, among others. So the changing climate, according to the rural community, has intensified these health challenges. So this definitely calls for some proactive measure at various levels, which has been mentioned by my co-presenters. Governments, public health institutions, households particularly, everyone needs to join forces so that we can address this issue of climate change. So what is the role of, for instance, public health professionals? Of course, they have a role. It has been mentioned before. They can assess vulnerabilities. They can identify at-risk populations. They can carry out health risk and enhance resilient behaviors. And they can collaborate with others as well. But what about public health institutions in Africa? I'm sorry to say, but sometimes public health institutions just adopt what other institutions are doing in terms of their curriculum. But there is knowledge and skills gap because we have to look at these content in context. So for instance, health delivery is going to be slightly different from the way it's delivered in other continents. Clinical skills, which seems to be a focus of our public health professionals, needs to be looked in context of what skills and knowledge are needed to address public health. Thank you, Cecilia, for presenting a really brilliant content for looking at the curriculum and contextualizing it. I wish that we could have a similar training going on in the Africa continent. I see it's all in the other regions. So why don't we do it in the Africa region to enable our health professionals and our schools of public health to urgently also integrate this content into their education. So what are some of the challenges? I think the challenge which I see is that of adapting and mitigating climate change in our context. So there's need for government. I know that it has been mentioned before that WHO is working with governments, which is really great because this is looking at the health systems. But then coming lower down where climate change affects individuals and affects households, there needs to be a greater interaction so that that gap between the delivery of health services and the access and use of health services is narrowed. And I think schools of public health can actually narrow this gap so that communities and households can see that they have a role to play. It's not all for the government. Each person can plant a tree, can take some barriers that will prevent flooding, can take some actions, some health behavior actions. So this is a multifaceted role for everyone because climate change is a crisis. Now, some of the things that can be done, for instance, associations like ASPHER, we bring together institutions and through education, research, which has been mentioned before, and policy influence, such collaborative platforms can come together and other associations so that they share the knowledge, they do research, they promote adoption of practices, because I fear sometimes each one of us wants to achieve. So we do our things separately and we report separately, but this is a global issue. And for Africa, we are really behind. It was presented in the Lancet presentation that those countries that are of low income are more affected by health issues are the ones that are really experiencing greater impacts of climate change. So we need to just partner together. I will just mention a few things which have already been mentioned before, of course, education and training, and I would focus on the curriculum. Can we make the curriculum more adaptable, more inclusive of climate change so that the professionals coming out of these schools of public health are confident and they have the skills and they can make decisions about what is happening in their own context. Now, about research, yes, research happens, but unfortunately for Africa, research funding is limited. And the truth is, for me to do research, I have to partner with somebody else from the north. because I just don't have those resources. But I think if we formed a collaborative partnership, then looking at lessons learned, sharing best practices in a neutral platform where I'm coming from Africa and others are coming with their learning, we can come together and share research so that it's not research in silos and it doesn't end up to be an expensive exercise. In terms of public health schools doing advocacy, again, I feel that they feel comfortable in their own silos. They feel comfortable doing their research, doing their teaching, publishing in peer review journals, and they feel a bit uncomfortable going out there and shouting out and saying, we need to do something, we need to plant trees, we need to come together, we need to train, we need to share knowledge. So I think advocacy for schools of public health, especially in Africa, they're afraid, and it's a sensitive area because coming out doing advocacy sometimes may be seen as political, as coming up against what the government is trying to do. But it can be done, especially if we have data that proves what we are saying and we share this with policymakers. I want to focus on community household engagement because at the end of the day, those are the ones that are going to really experience the adverse effects of climate change. So partnerships, yes, community engagement, research, collaborative associations and networks, curriculum, and so on. So if we come together and we just bring our brains together, we need more commitment towards making, especially Africa, more climate resilient through public health education and practices. And I think partnership with our partners in the North can make this a reality. Thank you.
Thank you so much, Margaret, for your presentation. And frankly, and I invite all the presenters to be with their videos on. I just want all of you to be here. And I think that all the participants in this webinar join me in really thanking this amazing group of people that are working very hard in order to really move the needle and working together in this critical issue. So thank you so much for incredible presentations, a lot of information, a lot of things to do. I just want to tell the audience that we just have very few minutes, maybe 7 minutes to take 1 or 2 questions. But I want you to know that you, like in a day, you're going to be able to see the recording. So go back to the recording just to know where to find us. It's important that all of you join this common effort, this global effort. So let's just take one of the questions that was raised, and it's open to any of you that can answer this question. But it says, what is the role of non-health sectors in mitigating health risks, and how can public health practitioners or researchers work with these other sectors to implement health protective measures which require action from other non-health sectors? Who wants to answer that?
I can give that one a go if no one else is putting their hand up. That is crucial. We always say that health is not defined by hospitals. Health is defined by cities and the place where we live and the place where we work. So health is really defined by urban planners, by energy professionals, by those that define our day-to-day. And that is why it's so important that we do sit at the table when those negotiations are made in terms of urban planning, in terms of the systems that sustain health. One of the things that I think it was Marina from the WHO that framed it really nicely is that what happens at the UNFCCC negotiations on climate change is a negotiation about disease, about what the future of health looks like, and we're negotiating with people's health and lives. So it's crucially important that we do have fora for interacting across departments, including health professionals in every decision that will affect ultimately public health. Now, how that is done is a bigger challenge because we generally operate in big silos, and governments in particular operate in big silos. We've had quite interesting experiences at city level. Cities in general have smaller governments in which different departments work a lot more in alignment with one another. And that is one of the areas where I think there's a lot of work to be done in terms of ensuring cross-departmental work and cross-disciplinary work on climate change and health. And most of all, ensuring that we advocate for health professionals to be taken into account within that conversation and to be sitting at the table when those discussions are made. I think the integration of health within the last COP has paved a bit of a way forward for health to be much better integrated with climate policies. And it has to go even beyond that on every other kind of urban planning, energy policy, etc.
Thank you, Marina. Professor Samet?
Just a comment. I think I mentioned local collaborations. I think this is an area that where our schools can be important in translating what we know generally to local context, whether it's to public hearings about the energy sector and emissions, for example, in Colorado from the oil and gas industry, transportation planning, other areas. I mean, I think what we have to do is to take these broad global models and what they say about health and talk about what it means in our own cities and neighborhoods. And that's a role our schools can fulfill.
Excellent. Laurent?
Yes, perhaps three very short comments. The first one, and the question was really good. The first one is we have to just look at what is the WHO important way of looking at health. It's health in all policies. So if we want to do health in all policies, we have to speak with the people who are in all policies. So that means that, and it was, I think Marina said, health is not the area for only health professionals. Health is for everybody. The second thing about the role of the public health schools within the academic area, I think that public health is expecting by the other areas of the universities to do something on what is the relationship between climate change and health. So we have to be very proactive, even in designing some very basic training for all the people in the universities. It's something that we have to do. And perhaps the last thing about the question is that, and it's what has been said by Margaret. I think it's really important not to escape to have some relationship with all the local policymakers, and it's really something important if we want to improve the health status of the population.
Thank you, Laurent. Cecilia, maybe you want to answer this last question, and some of you very punctual, but I really want to end with a hope and a positive note, and I like this question about that. The question reads, what optimistic signs are you seeing on people taking action in meaningful ways, whether that be on a local, national, or global scale? Where can we apply ourselves right now to make the greatest headway? Very punctual, because we have 2 minutes, and then John Milton will close us up. So who wants to respond to that?
I'll be super quick because I see so much inspiration, and I see it in students. I see it in this generation of health professionals who is demanding education on this, demanding that they be taught advocacy skills so they can go out into their communities and get this work done. I feel like the changes is around us, and I think there's a lot to be hopeful for. Thank you.
Awesome. Thank you so much, Ceci. Anyone else? Just 1 minute? No?
Well, I'll comment. I mean, I think we're all capable of change within the walls of our own academic institutions. And I think that is going to happen. It is happening. So I think it's going to be around education. It's going to be around research. And I think probably increasing collaboration and communication.
Thank you, Jonathan. All right. So with that, again, thank you to all of you. It has been just really a great and amazing webinar. And John Milton, who is here with us, and he is the chair-elect, president-elect, I would say, of the Global Network of Academic Public Health around the world. he will end up the webinar. So to you, John.
Thank you very much, Laura, and thank you, everybody. I think we've seen some great presentations today, some real inspiration, some real commitment from everybody on the platform, and immense experience, really. And you know, when I registered to join this event, I had one of those global consortium little questionnaires asking me what my experience of climate change was. And I put ad hoc and self-taught, which was something like what we found in the first survey of European schools back in 2020, when we found that the most we could expect of our schools was a single lecture in a master's course, and you know, the systematic study of climate change was much less in evidence. Nevertheless, we did have a few expert schools which we now call on for the course that Global Consortium have been helping us to develop and are now in the process of delivering. We've had our third lecture this week with the vital and immediate issue of wildfires and the health effects. And I think it's a very important and timely issue for us in public health, that we don't allow the public to consider that climate change is years away. It's with us now. It's causing immediate health problems, be it heat-related fires, floods, whatever it is. And we have to be properly educated and trained to respond, as well as to advocate for reductions in carbon emissions more generally. A number of our speakers have really hinted at the interconnectedness of public health, the interconnectedness of climate change, for instance, with conflict, the issues of drought in Syria and the Arab Spring, and the political ramifications of wars in Syria and the Middle East that have led to huge volumes of migration, leading to the rise of populist governments. All of these are very complex, interrelated matters. And when we look at the potential for new pandemics, we see deforestation and climate degradation totally devastating our agricultural production, our forest infrastructure, and bringing humans into contact more with different species that potentially give us the opportunity for new pandemics. So we can't be expert in all of these things, but we need to have our lexicon, our textbook, our phrase book of the language of town planners, the language of meteorologists, the language of ecologists and biologists, and the language of economists. And we need also the language of theologists as well. If we don't understand what people believe, how can we address their concern or lack of concern when it comes to something as large as climate change? So we do need to be able to not only speak the language, but we need, as Laurent was suggesting, to forge our partnerships. Public health can be a conductor in an orchestra. We can't play all the instruments. And it does seem to me that wider partnerships are needed across a whole range of disciplines who are all affected by climate change. Cecilia has challenged us with and Laura's challenged us to finish on on a positive note. On a slight downer, but perhaps not a realistic one. I've been talking to my students in Maastricht recently about why isn't there any progress? Why isn't there progress in tackling climate change to the extent that we need? One of the things that we've not adequately addressed really is the pervasive influence of fossil fuel industries and their coterie, their investment in think tanks in governments across the world, influential in Washington, in London, in Holland and Germany, that are undermining the science and the reality of climate change, and really just providing that deadening influence that the merchants of doubt provided when people were trying to get people to stop smoking. And we are arrayed against these very people who come with a large budget, are very influential, are very able to influence people who don't want to change. We're seeing that in big farming movements, particularly in Holland and Germany. And we're seeing it aligned alongside populist and right-wing governments and right-wing movements. So we as public health need also to understand the politics of where we work. And we need to be able to have our armory arrayed against the forces, the anti-health forces that do not want to see us succeed. So anyway, that downer is not supposed to be a downer. It's supposed to be a challenge and something that everybody in the audience, this mighty audience of nearly 300 people today, I thank you all for being on the call. And I look forward to further events of this kind. One thing that we can do that we can't do by going to meetings in faraway parts of the world, we can do Zoom meetings far more frequently. We can exchange our ideas. We can be influential in that way. And I very much look forward to seeing you again in the not too distant future with some better news and some greater news about how we've hit or reduced that target of 1.5 degrees temperature increase. So thank you very much. Over to you, Laura, for the very last word. Thank you.
Thank you so much, everyone. Have a wonderful rest of your day or night. Thank you.